introduce Dr. Liliana Pinete, who's a public health executive for over 20 years of leadership, with experience in supporting the health and well-being of underserved children and families, both in Romania and in the United States. Currently, she serves as the CEO of the Partnership for Maternal Health in northern New Jersey, a nonprofit organization with a mission to improve the health of women, children, and families. At the partnership, she's responsible for overseeing multiple programs and leading innovative public health initiatives. She's been contributing to the education of the next generation of public health and biomedical science students as an assistant professor and mentor. She received her medical degree at the University of Medicine and Pharmacy in Timișoara, where I'm from, and worked as a pediatrician at the Romanian Children's Orphanage, where she established a pediatric clinic, ensured medical care of children between 3 and 17, and conducted research studies on attachment disorders of institutionalized children. Dr. Pinete also served as program manager for an innovative program at the time for abandoned Romanian children named The House with Open Windows, funded by Save the Children. In addition to her medical degree, she holds a Master's of Public Health with a specialization in maternal and child health from the University of Minnesota, and she's also holds a nonprofit management degree from Columbia University School of Business. Dr. Pinete, you have the floor.
Good morning. I'm going to try to share the screen. I just have a few slides. Is this visible?
Yes.
Good now? Yeah. All right. Thank you so much. Good morning. And thank you for the invitation and for the kind introduction. Theo did a very good job, and I'm going to be very brief because he covered already my professional journey. But I want to start with a short story because coincidentally, this week, my 7th grade son interviewed me for one of his classes, American Studies, for a project called American Journeys, My Family, My America. And he asked me one question. Can you name 3 people who inspire you in the past? And can you explain why they inspire you? My answer was yes. I have had so many excellent teachers and wonderful mentors. And I share with him a few stories which really took me down memory lane. Then I realized that I had never written a thank you letter to my teachers and mentors. So I want to take this opportunity to say thank you to one special mentor who I think is here today, and who is an exceptional child psychiatrist, researcher, and innovative leader who believed in me, challenged me, and allowed me to work by her side. I took the first big and exciting steps on my career path, guided by this wonderful mentor. The skills and experience I gained back in Romania as a young physician have helped me along my professional journey. So thank you, Dr. Violeta Stan. So now I will start by going briefly through a few milestones of my professional journey. I was born, similar as the previous speaker, and grew up and went to school in a small town named Moreni, which is not on any map. That's why I decided to put it here on this map. It's from the county Dâmbovița in the southern part of Romania. After I graduated high school, I left my small town and took a path toward west. So my first stop was Timișoara, a beautiful city where I graduated medical school in 1993. Here is my alma mater, which I revisited this summer for my 30 years reunion. And I was very happy to reconnect with my colleagues after so many years, some of my happy colleagues there. In my 6th year of medical school, I became interested in child psychiatry. And my professor, Dr. Violeta Stan, engaged me in my first research study on attachment disorders of institutionalized children, which I presented as my capstone project. My first management job was at age 25, when the same mentor challenged and trusted me to manage the house with open windows. So I became the director, the first director of this project for abandoned children, funded by Save the Children and Handicap International. House with Open Windows was a revolutionary program, very much needed in Romania at that time to save and ensure healthy care and child development for the many babies abandoned in the maternity wards. These are some of the children we took care of in this family model home. And this is my first team. Equipped with new experience and skills, I became the physician for an orphanage newly opened in Timișoara, where I established a pediatric clinic and provided medical care for 75 boys. And this is my first medical office, which I started actually from scratch. I remember even today, putting the tiles and cleaning the floors and bringing furniture to create this environment for abandoned children. And those are some of the children. I still have those pictures. Those are the abandoned children I care for. And while being their pediatrician, I was able to continue to observe and study their emotional and behavioral disorders. I can say today that my work with abandoned children in Romania was the most meaningful experience of my career. However, my journey continued toward the east again and across the Atlantic Ocean. I was one of the lucky ones who won the Green Card lottery, and I received permanent resident visa for the United States. So I ended up in Minnesota, not because it's the coldest city, but maybe because it's on the same parallel, I realized, 45 as my hometown. So there I was introduced to public health and completed my master in maternal and child health at University of Minnesota. And during my graduate program, I worked at the Institute of Child Development, conducting research on 2 important studies: the neurobehavioral study of post-institutionalized children and the International Adoption Project, a survey study of Minnesota parents of children adopted internationally. I worked there with world-renowned researchers, and I remember doing the research in Romania just a few years before, when we didn't have actually not so many resources. I remember translating Bowlby's attachment theory from the few resources we had at the child psychiatric clinic, and coming to United States, we had an abundance of resources. After graduating with my master in public health, I was sponsored by Project Concern International to go back to Romania with a team of American professionals to implement a training program for the Romanian Child Protection Department, focusing on strategies to prevent child abandonment. My life and professional journey continue in New York, where I moved in 2002, right after 9/11. That's why here is a picture without the Twin Towers. In New York City, I had my first experience teaching at City University of New York, Brooklyn College. And I also continue my own education at Columbia University Graduate School of Business, where I completed an executive program in nonprofit management. My big leap forward in my professional journey was in 2002, when I started my career in public health, at a nonprofit maternal and child health organization, where I held various positions over the last 20 years. In my current role, I lead a dynamic team of public health professionals and oversee a portfolio of 30 programs for children and families in northern New Jersey. This is my team at the partnership. So this is a very high demanding, high intensity job, but I always try to find time for one of the most important tasks, providing mentorship to students, residents, and other young professionals. At this point in my career, it is a privilege to mentor and support the next generation of health professionals. So currently at my organization, I lead two programs. One is Rutgers University Equity in Action Summer Internship Program. It's a 6-week paid summer internship program for Rutgers graduate health and biomedical students, and I included a link there. If there are any Romanian students attending Rutgers University or planning to attend, that's an opportunity for them. And more recently, my organization became engaged as a host organization with the U.S. Department of State Community Engagement Exchange Program, which is a year-long program for civil society leaders for ages 21 to 28 from over 100 countries, designed to prepare the next generation of leaders. And I included a link there. This is, I think, a very exciting program. It's fairly new. I think they're their third year. And I'm very excited tonight. Actually, I'm going to meet via Zoom with my first fellow who start in February working with me at my organization, and she's from Mongolia. So I hope one of the future fellows will be from Romania. This is my contact information. I would like to be involved more with IRF and other wonderful organizations and professionals that I am meeting during this conference, like the Heron Foundation yesterday, and give back and support the next generation. Thank you so much.
Thank you for sharing with us your experience of having a mentor and for turning into a mentor for the next generation, and ending up by welcoming young people to apply for these programs and to access your expertise in public health. That is exactly why we have today people from Romania, from Bucharest, that could relay your invitation and bring fresh blood into our network of